Good morning, and thank you for joining this morning's brief webinar that will address several health-related topics that can impact the dealership's bottom line. I'm Brian Hughes, the Director of Communications at NJ Car, and I'm joined today by presenters Bruce Mazzarelli, Vice President of Employee Benefits at Hub International, Amy St. Pierre, Vice President and Senior Consultant of Health and Performance at Hub, and Lou Young, a Senior Consultant from Witham. Bruce, Amy, and Lou will discuss a variety of issues, including the financial impact of health benefits on the bottom line, how a thoughtful wellness program can enhance a dealership's efforts to attract and retain employees and improve the dealership's bottom line, as well as the components of a sound wellness strategy. Before we begin, I just have a few housekeeping details. On the right-hand side of your screen is a control panel. Please take particular note of the questions tab. During the call, all participants will be muted, but if you have any questions during the webinar, you can enter them in the questions tab, which I will be monitoring. So now I'd like to turn things over to Bruce to kick things off. Bruce?
Thank you, Brian. We appreciate everybody's time this morning. As Brian had mentioned, we're going to spend a little bit of time talking about health and performance as it relates to an employee benefits program. When we say health and performance, some folks may think of wellness, but I think you'll find after today's presentation, it's a much deeper and more rounded view that we're going to talk about today. And really, this is a result of thinking about the marketplace, having conversations with Lou Young between myself and him to talk about the challenges in the marketplace. There's significant cost pressure in the marketplace, but unfortunately, that's contradictory to our ability to attract and retain employees, right? If my health insurance program premiums are going up, I have to increase costs to the employees. That makes it more difficult to attract and retain. And so we'll spend a little bit of time talking about that as well, particularly the financial pressures that folks are going to find with increasing costs and how we can address some of those costs. So as Brian mentioned, your presenters today will be myself, as well as Lou Young. Probably doesn't need an introduction, certainly well ingrained in the dealership community here in the state of New Jersey, as well as Amy St. Pierre, who has significant experience in the industry, specifically in the wellness arena and health and performance. So those will be your presenters today. We're going to go through the slides. If you do have any questions, as Brian mentioned, you can put those out into the chat box. And here's the agenda of the items we're going to cover today. As mentioned, we're going to talk about the financial impact of employee benefits to the bottom line. We're going to kind of present a picture of the new reality, talk about specifically what is health and performance. Again, it goes beyond thinking of a simple wellness program that might give someone a reward for getting their annual physical, if you will. We're going to talk about who is your well-being champion, because it's important culturally. If well-being and health and performance is going to be a part of your organization, culturally it needs to be supported. We'll talk a little bit about pre and post-COVID trends, solutions for mental health, obviously a very big topic today. Then we'll talk a little bit about components of an effective wellness program, and then we'll wrap it up with an executive summary, and again, answer any questions you may have at the end. So I'm going to go ahead and turn it over to Lou. Lou's going to start talking about the financial impact and what he's seeing related to employee benefit programs.
Thanks, Bruce. Great to join you, Amy. This idea, and Bruce and I have been kicking this around for a few months. It started about 2 or 3 months ago when our firm was looking at dealership financial profiles. You know, we look at profiles for hundreds of dealership financials, and one thing that hit me pretty hard was the growth in employee benefit costs. And what we did was we did a little deeper dive back a few years and found that costs, specifically healthcare insurance premium costs, have gone up dramatically over that period of time. And at the same time, Bruce and I, in addition to costs, Bruce and I were talking about the problems that dealers are having attracting employees to the marketplace, and you know the time that we went through over the last year and a half, and what that meant at dealerships from an employment standpoint. And I guess Bruce coined the phrase, marry the two together, marry the cost component and the attraction of employees into one presentation, and get into the details of the some of the solutions that are out there and get Amy involved with this. So again, this has evolved. This is something that we want to talk about. As everybody knows, we've done 7-8 years of healthcare cost surveys, and we've gone to roundtables, and this is sort of an extension of that a little bit. But getting into the details here, we've seen increases of between 36 and 67% over the last 4 years. That's absolutely astonishing. And as you can imagine, these costs as a percent of dealership expenses has gone up dramatically as well. So, that's where we are today. And, this is very important because we're also in this period where something has to be done. We have to make sure that we can attract and retain employees moving forward. So if we go to the next slide, you can see there have been some surveys done, and we can see 74% of job seekers believe employers need to reevaluate their benefits that they offer post-pandemic. So these are things that are coming out of the pandemic. We talk about the Great Resignation. Well, this, and I'm always asking Bruce, what's the answer to this? What is the solution to this? Is there an easy answer to this? And as you will either already or you'll find out, there are no easy answers. It's a group effort. It's a effort that has to be a decided effort in the dealership community. So it's very important that we get our hands around this and we start to discuss what options are out there, what we can do. Again, 43% of job seekers say that benefits are more, just as, or more important, and 55% say they would consider taking a lower paying job if it offered better benefits. So, these are the kinds of things that we're hearing. This is the new reality. And so with that, Amy, why don't you go through some of these options, some of these thoughts? What can we do to help the bottom line?
Thanks, Lou. So the slide I have up there really shows us what we're dealing with today. Post-pandemic, it's a completely different world. It's full of a tremendous amount of new, unique challenges that we're all learning how to manage. I'm not going to go through each of the talking points on here, but we will touch upon them through my presentation. And of course, at the forefront of everything is mental health, which, as Bruce alluded to, that's something we will spend a little bit more time on because I do think it's super important. But the goal of today is to give you some ideas and some solutions to retain and to new employees and to attract new employees. Retain your current very, very well valued employees and attract new talent. So hopefully you're going to get a lot out of this. Please use the chat feature as I'm talking. If you have questions or you have comments to add, please include your comments. So in a survey that Gartner did in 2022, so the top of the year, 94% of companies made significant investments in their wellness programs. Pre-pandemic, well-being solutions, well-being programs were nice to have. They were a luxury. And I've been doing this, as Bruce said, for a very long time. My job has changed tenfold over the past 2 years. It is now absolutely a must. If you want to stay in the forefront of your unique work environment, you have to include well-being programs. 85% of those that were surveyed increased their mental health support, 50% increased support for physical well-being, and 38% increased support for financial well-being. And that third one, this was again at the beginning of the year. I think at this point, with all of the changes in the world financially, I think that's probably increasing on a daily basis. One of the main new trends, the new talking points, is quiet quitting. What is it? How can we help? I think it is such a catchphrase that's out there. We need to be aware of it and we need to be tackling it. So quiet quitting is when workers do the absolute least amount of work required to continue to get a paycheck without raising red flags. I actually was just talking to someone a couple days ago, and one of their employees, they thought was working. They were doing the very, very bare minimum and had a second job. So they were double dipping. They were getting 2 paychecks. And it took this HR team about 6 months to realize what was going on. So this is happening out there. The main reason for this is burnout. You know, employees are burned out. All of these new challenges, it's very difficult to tackle. They don't feel their employer is giving them the tools to navigate this. So this HR executive survey that was done of 1,000 employees, 21% of those employees said they already have that mindset. That's staggering. Another 5% admitted to doing less than what's required of them. So maybe they were working harder pre-pandemic and now they're kind of slacking a little bit. A third of all of them said that they have cut their working hours in half. And 8 out of 10 claimed, again, the main reason is burnout. 90%, so 90% of those said that they could be incentivized to work harder. And it's really easy things: more flexible work hours, increase in well-being offerings, and employees just want to be heard. They want to know that you're listening to them and that you're addressing their needs. So I know it's a little tricky with car dealers, flexible work hours. You know, that's difficult because you have your hours that you need to have in the service area and in the sales department. But there are lots of other things that you can do to just increase kind of the loyalty and support that the employees feel that they have. So what is health and performance? What do I do? So health and performance is helping you create a happy, healthy workforce. It's not simply, oh, let's put in a fitness program or let's give a mindfulness app to the population. Let's look at everything. Let's look at all of the pillars of health. Let's look at physical well-being. Let's look at financial well-being, emotional and mental. Again, that's a top one. And then the social and community well-being, feeling of being a part of something bigger. And then at the center of all of that is, how do we bring it together? How do we give a quality employee experience? And through that, we're going to give a quality employer experience. It's kind of like that happy wife, happy life. It's a happy employee, happy employer. So how do I do that? What do I do when I'm looking at a client? How do I evaluate what's happening within their company? You know, it is reviewing all sources of well-being programs. And one thing that I've really noticed is that a lot of employer groups don't know what they currently have. They don't know what's embedded in their health plan. The carriers post-COVID have done a really amazing job of embedding very robust mental health support, emotional support programs, as well as disease management, diabetes prevention programs, musculoskeletal programs, all things that are needed in post-pandemic trends. So first and foremost, reach out to either your broker, your consultant, or your carrier rep and find out, hey, what do I have in my program? Market those, advertise them, educate your employees on them. Could be missing the boat on a lot of valuable programs that are at no cost to you, that are already embedded. You're already paying for those through the health premiums. Chronic condition support. Chronic conditions are at an all-time high. A lot of people didn't go to the doctor, didn't manage already chronic conditions because they were afraid to go to the doctor or the doctor's offices were closed. So they missed opportunities to manage and keep conditions at bay. So it's more important than ever now to make sure that employees with chronic conditions have the support for them. And again, those may already be embedded in your health plan. So it's just a matter of educating yourself and then your employee population on those resources. Wellness funds. Carriers give wellness dollars. If you don't have them, or if you don't know if you have them, ask your carrier rep, ask your broker. And if you don't have it right now on renewal, ask for it. There is no reason that any company shouldn't have wellness dollars. And those are dollars that can be spent to help engage your employees in well-being. And there is no additional cost to those. Again, the big carriers just add those into the program. And then we need to talk about communication, because it's great to have all these amazing bells and whistles and things that are included in your health plan, but how are you going to educate your population on those? And again, car dealers, that's a tricky population. You've got people all over the place. A lot of times you have multiple locations. You have very different departments, very different employee populations in each of those departments. So how do we tackle that? How do we make sure that everybody is informed? And an employee portal to bring it all together. One of the things that Hub does, which I love, we have something called Benefit Spot. It's an app that houses all things benefits. So there are a ton of them out there. A lot of times carriers or vendors have something that can tackle that as well for you. So that's definitely something to look into. And again, we'll talk a little bit more about that. So prevalence of chronic disease, I kind of alluded to this before, but you know, pre-pandemic, 6 in 10 adults in the US had a chronic disease. Again, these numbers slightly outdated. I would say that right now, probably 8 in 10 have one, and probably 6 in 10 have 2 or more. So if I have a cardiac concern and I'm diabetic, that's 2 or more conditions. These things, these cost employer groups 75% or more of their total claims. So these are things that are mostly related to lifestyle. And if we change our lifestyle, we keep our employee population happy and healthy, we give them the tools to do that, all of a sudden, these things are going to decrease. And ultimately, that's our goal, right? To decrease claims, decrease overutilization, unnecessary utilization. And when things are controllable like this, it's super easy to help the employees gain a healthier lifestyle. So just so you can get an idea by generation, what the chronic conditions and the cost drivers are as far as claims, I put this slide up. I absolutely love this. This is the first time ever that we have 5 generations in the workforce. Clearly, every generation is different. If you look, Generation Alpha, they're the youngest population right now. Infectious disease, of course, is COVID. But if you look at the different top spending conditions, you'll see that they're very different by generation. So Generation Z, mental disorders. That is the biggest issue right now going on across the world. Millennials, it's pregnancy. Generation X, cancer. So what I do like to point out, only kind of for comedy, is Generation Z, their number 2 driver is injury, driven by ortho, which is orthopedic, and head injuries. I have so many questions about that. I have 2 Gen Z boys, so I've asked them, and it's staggering what you hear. It's all about the what they can record and post to TikTok for likes, right? So, but so interesting to know. And again, going back to, we have to make sure that we're addressing each generation in the way that is best for them. This just shows you how we have to tackle different conditions for each generation. So who is your well-being champion? Whose job is it? So it's my job at Hub. So if I'm brought into one of Bruce's clients, that's what my job is. But if you don't have a me, who do you look to? Look to your health plan. All of the big carriers have wellness teams. They have, wellness support that partner with your client managers, and they can help you create a very robust wellness plan. They can look at claims if you have access to that. They can make sure that chronic condition and disease management programs are put in place. If you don't have a wellness person attached to your health plan, look to your broker or consultant. Do they have a me? Do they have a health and performance team? Do they have a wellness team? Do they have someone that can support you? HR, is there a team member who feels strongly about well-being? So maybe your HR team is stretched very thin because we saw all of the issues that they have to deal with. Is there an employee who maybe is a marathon runner or is very into mindfulness or very into healthy eating and nutrition that would be willing to take this on? I have a couple of clients that the person that manages their wellness program has nothing to do with the HR team. There's actually 2 of them are IT people. They just feel so strongly about it, and they want to make the company feel like they're part of a whole. So they've taken that on. Are there employees who are passionate about health and well-being? Are there multiple employees? Can we put a committee together? And can we get somebody maybe from the service department, from the sales department, from the office? So a little bit of the voice of the people from each of those areas that can talk about what their particular group of employees wants and needs. Or you could always look to an outside vendor. There's usually a fee for that, but they could work with you to create a program as well. So pre-COVID and post-COVID. Pre-COVID, very different from where we are today. I won't spend a lot of time on this. We all lived through it. It was everything on site. Health fairs, maybe happy hour after work, social gatherings. Maybe you had a yoga person come in. The biggest struggles we had were commuting struggles. Who's taking an hour to get to work, or childcare issues, things like that. Work-home life balance. People were working a lot of hours in office. So those were the issues that we were tackling. 2022, this is the year that well-being goes mainstream. Like I said, it used to be a luxury. Now it's a must-have. This has to be a part of your business strategy if you want to keep those valued employees and recruit new employees. So post-pandemic, again, there's so many things we can talk about. I think the number one is the Great Resignation. 33 million employees quit their jobs. Many of those employees quit without having another job to go to. So they just felt that, you know what, I'm going to take the financial hit because I have some caregiver responsibility. Maybe it's to take care of children. Maybe it's to take care of an in-law or a parent. Whatever it is, they just felt that they could not stay in the workforce and have that work-home life balance. So burnout, working from home. I know, again, car dealers are a little bit different. You don't have the luxury to work from home, but even just seeing the companies that I worked with that didn't have a chance to, and I don't want to say enjoy the pandemic, but to be home, they have a lot of stress. They have a lot of resentment. So there's a lot of different challenges that the population has. Chronic conditions, again, they got worse from lack of appropriate care. COVID weight gain. COVID-19, the running joke in my world is that COVID-19 is like the freshman 15 at college. The average weight gain, unfortunately, it wasn't just 19 pounds, was 26 pounds during COVID. So that's a real issue. That increases pre-diabetes, diabetes, heart conditions. That's something we have to tackle. Financial strain. Those that lost jobs, I'm sure your dealerships were shut down for quite a bit of time. The problem with that is that that's lost income that never came back to these employees. Musculoskeletal issues. I'm sure your service department has a ton of musculoskeletal issues just from the nature of the work that they do, but also those that work in the office, not sitting in an ergonomically correct workspace, low back pain, we're on our phones, we're on technology, our traps and our neck issues that go along with that. Huge increase in substance abuse, huge increase in domestic violence, whether it be emotional or physical, and loneliness. Suicide rates tripled. So those are things that we definitely need to talk about. We need to be aware of. We need to let our employees know that we're aware of these. What am I hearing? Biggest ask is mental health, behavioral health, emotional health. And it might not be the employee themselves that are dealing with these issues. I would be very remiss not to mention young adults. So if you've got young adults, ages 13 to 18, biggest affected right now, you need to make sure that your family has the resources that they need. So again, it might not be the employee who's in need of this, but it might be their dependents or their spouse. So we need to be aware that if someone at home is struggling with mental health issues, that's going to directly affect the employee's productivity when they come into work. Caregiver support. Who's taking care of their children? Who's taking care of the in-law? Maybe you pulled an elderly relative out of a home health situation or a nursing home and have them now in a home health care situation where you need to be the caregiver, or the employee or the spouse needs to be the caregiver. You have to be cognizant of that. You have to let them know that, hey, I understand things aren't easy at home. And again, the largest prescription claims are always mental health. Mental health is number one, musculoskeletal, cardiac, and then diabetes. They're all kind of related in there. So, we'll talk a little bit more on the whole about how to tackle those. So first, again, number one ask, I haven't been on one call with a client, doesn't matter what industry they're in, that they have not asked me to help give them more support for their employees in the mental health and emotional health. Pre-COVID, 1 in 5 Americans suffered from mental health. Post-COVID, 2 in 5. That's 40% of the US are saying that they're struggling with some sort of mental health or substance abuse issue. 78% of those employees are saying their work is negatively impacted by it. And if you look at the cost, $53 billion was the annual spend pre-COVID. Today, $200 billion. That's tremendous. If we can give the employees and their loved ones the support that they need, our healthcare costs will significantly decrease. So how can you help? Promote your programs, educate and support your employees and their families. Again, I can't say and their families enough because it is the young people that are really struggling with this. And break the stigma. I love when I do either, on-site presentations or HR talks and they give personal examples. If they hear you, C-suite executives, talking about a personal example, and maybe it's your cousin, it doesn't have to be you or your loved one, but when they hear that you're affected by it in some way, shape, or form, it makes them feel like it's okay. And I think that is, if you get anything out of this, that's the number one thing. Use a personal example. Get someone in the C-suite or on the HR team that can really connect with the employees and let them know that it's okay. This is very common. I understand what you're feeling, and this is what we're going to do for you. Have these discussions. Have marketing pieces available, especially if some of your employees don't have access to company email. Have posters up in break rooms and lunch rooms or in the shop. Let them know where the support is, how much it's going to cost them. That's very important because a lot of people are afraid to reach out to the health plan because they're afraid that it's going to break the bank and they can't afford that. Make sure that employees know resources, especially EAP programs, that these are 100% confidential. EAP programs, I would have thought the utilization in them would have gone up tenfold, and it really hasn't. It's gone up, but not as dramatically as it should have with the mental health crisis. And I think the main reason is employees truly don't understand what an EAP is. And because it's at no cost to them, provided by the employer, I think they think that the employer is going to find out what they're using the EAP for. So super important to make sure that your employees know these are 100% confidential. And then another fun thing to do, create Mindful Mondays, midday mindfulness. All of these these health plans have some sort of mindfulness program built in that's either at no cost or at a very, very low cost. And if your plan doesn't, these are things you can get for less than $1 per employee per month for a very robust, exciting plan that the entire family can join in on. And I can give you examples of those. One that I really love is called Mindful. Another one is called Wellbeing. There's a ton of them, very inexpensive, great, just bells and whistles for the employees and their family. The other thing we kind of mentioned, again, you guys are unique here, but sitting is the new smoking. Again, everybody gained weight during COVID. It doesn't matter what line of work you were in. It was stressful. Stress makes us hold on to weight. A lot of people were more sedentary than they used to be, especially if they were commuting to work, walking around the showroom, whatever it may be, walking up and down stairs in the different offices. During COVID, we sat, we hurt our backs, we gained weight. We have an increase in heart conditions. We have an increase in diabetes and prediabetes. So this is something that needs to be addressed. We always used to be smokers, and smoking is still out there. Vaping is, bigger than ever now. So we always need to tackle smoking. But second behind smoking would be tackling weight gain, some sort of exercise or challenges. If you did just a walking challenge or a steps challenge and had a prize, it could just be a raffle prize. It doesn't have to be something that's going to break the bank for you. You would have, such an increase in excitement, and it releases endorphins, and all of a sudden you see things differently. I joke with my family, I'm a big runner, and I say running saves lives, saves my family's lives, because if I didn't run, definitely wouldn't be a family of 5 anymore. I don't know how many we'd be down to. So exercise is good for you, most underutilized antidepressant out there. So just a simple walking challenge would be an amazing way to increase camaraderie and get everybody excited and moving their bodies. COVID rate, I'm not going to go over this again, but you know what? COVID weight gain, it's real. It happened. We've got to change that. And the pandemic's over now. It's an endemic. We have to move on, and we have to work with the new world that we're left with. So what are the components of an effective wellness program? Number one thing, like I said, this is what I really want you to lead with: leadership support. I want you to use personal examples. It needs to come from the top down. You need to tell your employees how important it is to move their bodies, how important it is to speak to somebody if they need to speak to somebody, where these programs are, how do you access them? And we need to make sure that, again, we're communicating with the appropriate generations the way they need to be communicated with. My 75-year-old mother, it doesn't want to text me. She wants me to pick up the phone and have a phone conversation with her. My kids don't want me to pick up the phone and call them. I have a 22, a 19, and a 16-year-old. The boys, they want me to text them. A text is just as good as me having a phone conversation with them. So we need to make sure that we're communicating with each generation the way that they best receive that communication. Target programs. Don't throw up on your employees. Let's say you leave this call today, you reach out to your carrier rep, and they tell you all these amazing programs that you have embedded with your health plan that are at no cost. You can't just throw all those at your employee population. They're not going to listen. And I'll show you what their attention span is. It's seven seconds is the average attention span. You need to each month pick a topic, focus on that topic. That's where you're going to get engagement. That's where you're going to get the real value from it. Incentives. I know that times are tough and you probably don't have a lot of excess money, but something as simple as a raffle. Join the STEPS challenge and you'll be put into a raffle. And the raffle could be for, a Dunkin' Donuts gift card, could be for something more valuable. Maybe you put in an activity each month. Do each activity each month, get 12 raffles to go in and get this bigger prize. It can be something very, very simple. Evaluate what you're doing. Don't just throw it out there and be like, okay, I did my wellness program. Look, after the year or after 6 months, review what you did. Survey your employees. Did it work? Did your employees love something more than something else? And then make a strategic plan for the following year. So stay in front of your employees, support them, show them that upper level management is all in on this. You care about them. Listen, have an open door policy. And, tell the leaders of the different areas of the dealership to come and talk to me. Come and talk to me. Tell me what you think you're missing. And if employees are leaving, why are you leaving? In that exit interview, ask them. And if you're not doing exit interviews, absolutely do them. But ask them, hey, why are you leaving? I'm going to tell you, from what I've heard, 9 out of 10 times, it's not money. It's not money. It's being heard. It's support. It's these added extra programs. It's just wanting to feel that you're being heard and wanting to feel that you understand and that you have the tools to meet the employee's needs. So I said I would show this. 7 seconds is the average human's attention span. 8 seconds is that of a goldfish. So, that's pretty sad. One of the other things that I love, 53% of millennials would rather lose their sense of smell than lose their technology. That's crazy to me. And then the last one, down in the corner, more people own a mobile device than a toothbrush. So if that doesn't tell you how our society has changed from me, I'm a 50-year-old, from when I grew up, I don't know what does. The majority of our population, more than 50% of the workforce right now, are millennials. So we really need to tailor communications to them. But if you look across at the red for the communication strategy, as I said, we've got these 5 generations in the workforce now. The communication strategy has to be tailored to each generation. So if you know the majority of your employees are baby boomers, Gen X, and millennials, make sure that you're emailing, that you have some sort of text component or push notification component. Everybody has a phone. You're missing the boat if you're not communicating with your employees via a push notification. They can say they didn't get the email, they can not pick up the phone call, but they're gonna be hard pressed to say, oh, I didn't get that text. Everybody gets the text. So push notification programs, super popular, an app that houses all your well-being resources, that's gonna really hit all of your different generations. The other thing, we said attention span 7 seconds. Key to communication is short videos. So I'm sure, I'm not a TikToker. I've been seen in TikToks because I have a 16-year-old daughter. But if your HR team is willing, do a quick little TikTok video about the benefits that you offer. A quick little, 3-minute video. Everybody will watch that. They're more apt to watch that than to pull open a PDF or look at a Word document. So you have to move with the times. I know it's difficult, and it definitely takes a lot of creativity, but that's the way we're going to get everybody's attention, and we're going to get them engaged, involved, and educated. So every single day, and I'm sure all of you get this as well, I get probably 15 to 20 emails from new vendors, new well-being companies that want to talk to me. They want to tell me how great they are. What do you do with that? So the key to vetting these vendors, and this is a major part of my job, is to ask them some key questions. You don't want to be the guinea pig for any of these. It might sound really amazing. We'll give you 3 months free, and then you just have to pay whatever moving forward. Nothing's ever free, first of all. I know you all know that. But the key to vetting these vendors, find out how long have you been in this space. If they've been in since COVID, maybe not the best company to jump onto. What size companies do they offer to? Some of you might just have 50 employees. Others might have 500 employees. Some of these companies, especially in the mental health arena, only offer to larger size companies. They won't entertain smaller companies. So you want to make sure that you're not finding out all this information and then later finding out that, oh, you know what, that's not even available to me. Can you afford the cost of the program? Do you have those wellness funds? So remember, ask your carrier, hey, do I have wellness funds? Or ask your broker, are wellness dollars built into my health plan? If not, do you have monies that you can set aside for programs like this? Or can you make it voluntary? There are programs that you can offer to your employees and have them either pay a portion of it or pay the full amount. So that's something that's very important too. If you don't have money set aside, only look for companies that are offering voluntary benefits. And does your health plan allow these vendors to be submitted as a claim? There are some mental health programs. There's some chronic condition programs that you could actually submit into your health plan as a claim instead of having to pay either a per employee per month fee or a per participant per year fee. So, these are really the key questions to ask. And then it really comes down to what can actually help the majority of your population. Again, we have all these different generations. Everybody's needs are different. The older population need chronic condition support. The younger generations need more mental health support. So you have to make sure there's a little bit of something for everybody. And then, of course, finding funding for these programs. You have to make a decision company-wide. How important to us is this? Are we losing a lot of employees? Is this an investment that is super important for us to make in order to keep our employees and to bring on new employees? What's hot? I wanted to touch on lifestyle savings accounts. You might have heard of them. You might have heard them being called specialty reimbursement arrangements. There's all different names for them. But what they are, they're a creative funding solution for smaller employers and for large employers for that matter, who don't want to purchase a vendor for all employees. So as I said before, you've got all these different generations in the workforce. Everybody needs something different. Maybe you can't afford to purchase a mental health program and a fitness program and a chronic condition program, but you have a certain amount of money that you can put aside for each employee, either each month, each year. You decide. The beauty of a lifestyle savings account is that everything that comes of this program is in your hands. It's a post-tax account, so it will go towards the employee's total compensation at the end of the year. Any size client can purchase this. So if you have 10 employees or you have 5,000 employees, this is something that you can get. There's a small per employee per month fee attached to it. There's no IRS regulations at all. Again, you as the employer choose what you want to cover and what you don't want to cover, and you can change that throughout the year. So with the Roe v. Wade reversal, a lot of employers, not really New York and New Jersey employers, unless they have employees outside of the metro area, want to be able to cover pregnancy terminations for their employees. But those employees are going to have to go to states where it's covered. So if you have employees in Texas, maybe they have to come to New York for that. There's going to be significant travel and lodging expenses. They've used this as a vehicle to fund those expenses for the employees. Again, you can set the funding up any way you see fit. And at the end of the year, if the employees don't use it, the beauty is the money stays in your account. So really an amazing solution when you don't know what to do, but you want to give something to all employees. And when the employees have choice, they love it even more. It makes them very happy to be able to choose what they want to do with funds. And I've seen employers do something as little as $7.50 every Friday for 2 slices of pizza and a soda. There's a client in Mid-America. There's a local pizzeria. Every Friday, the employer puts in their account $7.50. So every Friday, these employees know they can go to the local pizzeria, get their pizza. They don't have to worry about bringing lunch. Very low paid industry, very poor area of the country. It does everything for these employees. It's the one time a week they know they can get a meal outside of the house. So it's really impactful. So it doesn't have to be $1 million. It could be just something little, letting the employees know that you care. So I'm going to close it off. I think, as you know, companies with exceptional wellness programs are going to be very, very high performers. The more you do for your employees, the happier your employees are going to be, the more productive they're going to be for you. Really, really easy concept. And so I just highly recommend either doing a survey or open door policy. Listen to the employees, find out what they feel is most impactful and important to them, and help them get that, whether it be through a voluntary program or through something that you can fund. Moving into the future with health and performance, find somebody who can be your well-being champion. Support mental health. I can't say that enough. Support mental health. Right? And again, for the whole population, not just for the employees, for their young adults and their families, for their dependents, and for their spouses. Pre-diabetes and diabetes, they're the new pandemic. That's something that we definitely need to address. Get your population moving, give them healthy eating suggestions, be creative, find things that are going to really impact your specific population. There is no one size fits all. Everybody needs a customized, tailored well-being program. And then again, same thing, just listen to those employees. Every single survey I've read, every employer conversation or employee conversation that I've had, all comes down to, I need my employer to listen to me. And communication, that's the key to everything. So I hope you enjoyed this. I hope you got something out of it. I'm going to put my information up here. If you have any questions or you wanted to reach out, have a chat about your unique situation, I'm happy to help. And we'll take any questions.
I have a question, Amy.
Sure.
Can I start? And Brian probably has some as well. Are we going to get to the point where the insurance company is going to pay for some of these costs, bear some of the costs for these wellness programs?
So That's a great question. And they actually, many of the big insurance plans do have a lot of these types of programs embedded in them. Like I'll just use, like Cigna, for example, has Talkspace and Ginger. Those are mental health, emotional health support programs. The problem is there's a cost to them. So a lot of us now have high deductible health plans in place. Those programs are still going to be subject to the deductible. And then once the deductible is met, whatever an outpatient mental health consult fee is. So they do have these programs embedded in them. They all have diabetes prevention programs, and those are at no cost to the employee. So those are super important to get employees engaged in, but there are registration criteria. So they are offering, I always find the most impactful thing to do is to ask for those wellness dollars so that you can choose what programs you want to put in, and you have assistance with the funding of that through those wellness dollars.
Yeah, if anybody has any questions, we don't have any in the questions tab yet. But if anybody has any questions, they can submit them now. I guess while we're waiting, give everybody a chance to do that. I guess if all three of you want to just, Amy actually used this phrase, if there's one thing people take away from each of your presentations, if you want to just kind of reinforce what you want them to take out of this, and we'll give everybody a couple minutes if they have any questions. So let's start. Since Amy just talked so much there, well, let's start with Bruce.
Sure. So when I'm thinking about the topics that were covered today, I think the important thing to consider is I was thinking about it. And so at the end of the day, particularly because when we take a look at the dealership environments, it's fast-paced, it's sales-driven, culturally, it's probably a little bit different thought process than what you may have had in the past. But the realities of today that were presented, that new reality, really are kind of forcing your hand. And I think if you can embrace it culturally, again, through strong communication, it will make a tremendous difference, particularly on the well-being of your employees and your ability to attract and retain. So that would be my key takeaway from today personally.
Okay, how about you, Lou?
I can't stress enough. This is becoming a much greater portion of our expenses. It's something that we need to consider from a financial standpoint. And I think that what I'm learning from Amy and Bruce and others is that, we really have to look at our operations as a traditional employee-employer relationship arrangement. Everybody's got to be seen as, has to be seen as an employee that is affected by these real-world circumstances that we're in today. And I think dealers tend to compartmentalize, the needs of the service department, the needs of the parts department, the needs of the sales department. I think everybody's got to be seen as one, all employees equal. And these suggestions that Amy's provided today need to be thought about and really considered. There are no easy answers, as much as I look for them, but we must think about this if we're going to bring these costs into control.
Yeah.
And then how about you, Amy? I know you kind of stressed a few things, but you want to pick one?
I think the number one is C-suite executive team, HR team buy-in. I think you need to let the employees know that these are important things to all of you, to you and to them, because whenever anyone, it's just like a child and their parent, when they see the parent doing something, they're going to emulate that. So if you let them know that it's okay to not be okay and that there's support out there, they're going to appreciate that, and then they're going to engage. And that's when you're going to see engagement and all of these types of programs really go through the roof. So if you could take anything away from it, I think listen to your employees and let them know that you're there, you care, these things are important to you.
Okay, great. Well, we almost hit our 45-minute mark, almost exactly. It's a couple minutes over. You guys must have been good because we don't have any questions. So you got Amy's contact information there. Most of you on this call, I think, are familiar with Bruce and Lou, but we can get you in touch with them if you have any questions. So I'd like to thank Bruce, Amy, and Lou, and thank you to our participants. A recording of today's webinar, as well as the slides, will be posted on the NJCAR website this afternoon, in case anyone missed a portion of this or feel there are others in your dealership that need the information that was provided, which I think there probably are some that would like to have their coworkers or the colleagues take a look at this. To Amy's point, dealer principals. If your dealer principal probably should take 45 minutes to have this, play this in the background and listen to what Amy, Bruce, and Lou were saying. So I think that's it. So thanks again, and that concludes today's webinar. Thanks,
Thank you, everyone.
Amy, Bruce, and Lou.
Thank you.